Hello, good afternoon. My name is Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to another episode of our Open Clinic with Dr. Chudi on YouTube. Excuse me. Today we're going to look at Clomid. I'm sure you've tried using Clomid by yourself. I'm sure probably your provider might have recommended Clomid. I'm sure you've used it and either it helped you or it harmed you. So today we're going to look at Clomid. We are going to look at the possibility of Clomid helping you to achieve pregnancy. Then we are also going to look at the possibility of the harm you can derive from Clomid when you abuse Clomid, especially if you're a Nigerian. So the possibility of having easy access to Clomid is very, very easy. Nigerians and other people in West African countries, Clomid is sold over the counter. So you can go to any pharmaceutical shop and you can just tell them, oh, I want to buy Clomid for 12 months. And they will give you Clomid freely. Over here in America and a couple of other developing countries, you cannot use Clomid unless your provider prescribed Clomid. And the only person that should genuinely prescribe Clomid for you is who? A fertility specialist. Now, my people, listen to me carefully. We are going to look at the function of Clomid as regards the female fertility system, the female reproductive system. Before I start, let's quickly take a poll. If you can hear me clearly, if you can see me clearly, just give me a thumbs up in the comment section and also keep your questions. When I'm done, I'm going to take care of your questions. Now, have you used Clomid before? It's going to be an interactive session. So have you used Clomid? Do you know about Clomid? Do you understand how Clomid works? Do you understand the dangers of using Clomid? Which other drug do you use freely? I know in Nigeria and other developing countries, you can easily go to the pharmacy and buy anti-malaria, painkillers, antibiotics, including Clomid. Now, majority of people out there will use Clomid by themselves because of what their friends told them. Oh, I used it and I have triplets. Oh, I used it and I have twins. Oh, I used it and I have multiple pregnancy. Yes. Is everybody in need of Clomid? No. Are you likely using Clomid wrongly? Possibly, yes. Majority of people that use Clomid used Clomid wrongly. Now, let's start with what Clomid can do in the body to help a woman. First of all, for you to use Clomid, you have to have a diagnosis. So a doctor will diagnose the need for Clomid, then prescribe Clomid for you. Clomid is used for people that have ovulatory problems. That means you still have eggs, but for some reasons, the eggs are not being released during ovulation. If any condition in your body leads to the inability of you to ovulate, then Clomid can come in handy to help you. So we can use Clomid to treat different levels of female infertility. So if you have polycystic ovarian syndrome, in polycystic ovarian syndrome, for some reasons, when we go to your ovaries, you have multiple fluid-containing bodies, which will affect your ability to ovulate. So women that have polycystic ovarian syndrome, the major problem they have is what? Lack of ovulation. So we can use that to handle polycystic ovarian syndrome. So Clomid can be given to you by your provider if you have a diagnosis of polycystic ovarian syndrome. Now, if for some reasons you are having an ovulatory cycle means you are bleeding. You have your regular period. But when we check your hormones, when we look at the progesterone, when we look at the FSH, when we look at the LH, we discover that you are not ovulating. When we do follicular tracking, we discover that you are not ovulating, but you have X. So the criteria of using Clomid is to make sure that you have X. If you have gone into menopause, you're punishing your ovaries because you no longer have X. So Clomid can only be used for women that are still within their reproductive cycle. Very, very important. Now, what kind of drug is Clomid? Clomid is a drug that will mimic your natural hormones. So there are two hormones I want you to pay attention to: estrogen and FSH. And also we throw in LH. So when you are taking Clomid, Clomid will go to your brain. There's a special place in your brain called the pituitary axis. That's where all the hormones in the body are made first before they are distributed to the body to be controlled. When you are taking Clomid, Clomid will tell the brain that the level of estrogen in the body is reduced. When that happens, estrogen and FSH have a love-hate relationship. So when your body senses that the level of your estrogen is low, by blocking it, the level of production of FSH will go up. FSH stands for follicular-stimulating hormone. Follicular-stimulating hormone is the hormone that will go to your body, go to your two ovaries, and start stimulating the follicles. When the follicles are stimulated, by the middle of the month, if you have a 28-day cycle, on day 14, one dominant follicle will burst and the eggs will be released. And if your partner meets you, you become pregnant. So the essence of taking Clomid is to mimic a blockage in the production of the hormone so that the level of FSH will go up, so that the level of LH will go up. When the level of FSH and LH goes up, what will happen? You will stimulate more than one follicles. So the pathway of having multiple pregnancy using Clomid is the ability of Clomid to go to your ovaries and stimulate more than one follicle. And remember that the LH hormone, it's the luteinizing hormone, is the hormone that goes up when you are about to ovulate. So when your FSH level is up and your LH is up, that means you will prime the eggs. Some women can develop more than one egg through the process of super ovulation. Now, when those two eggs are released, the LH will go up. Once it's released and there is availability of sperm, you will become pregnant. This is the natural way of becoming pregnant. Now, when you go about using Clomid the wrong way, what's going to happen? You're going to deceive your reproductive system. For example, if you don't have eggs no more, if you've gone into menopause and you're taking Clomid, what are you doing? You're ingesting poison. You are increasing the natural, you are causing a disbalance in your natural hormonal balance. So when you do that, you are increasing the level of the artificial hormones in your body, predisposing yourself to developing cancer. Now, the research about Clomid and cancer is still developing. We don't know for sure if using Clomid directly will lead to cancer, but we know that is a risk factor. Let me repeat. The same drug I can give you to go for fertility treatment, the same drug I can give you for IUI, for IVF, under controlled management. If you don't use it exactly the same way I give you those drugs, you can predispose yourself to a lot of risk factors, including cancer. So the ability of Clomid to likely have a link with cancer is dependent on abuse. So women that use Clomid under the care of a fertility specialist will not develop cancer. But women that go about taking Clomid like water will increase the risk level because there are a couple of other factors that can lead to cancer independent of Clomid. For example, if you have a bigger BMI, if your BMI is 30, if you have a familiar history of cancer, if you've been using Postinol, then currently you're using Clomid. What have you done? You have caused an ambient opportunity for cancer to thrive in your body. So if you are going for Clomid, Clomid is normally given for a few days, starting from the beginning of your cycle. Remember that your cycle starts from the first day of your bleeding. Some providers will tell you to start your Clomid on day 3, day 4, or day 5. Now, it's expected you just use your Clomid for a few cycles. Most times, it's just for 5 days. Once that 5 days is done, we check. Sometimes we run our hormones, sometimes we do some ultrasound to see the effect of the Clomid you are using. Some doctors will start you on a little quantity, then they will go up depending on how your body responds. So Clomid is not your everyday paracetamol. Clomid is not your everyday painkiller. Clomid is not your anti-malaria. Clomid can help you and harm you. The only way Clomid can help you is if you have a need for Clomid and a fertility specialist actually recommended Clomid, then Clomid can help you to achieve pregnancy, even to the extent of having multiple pregnancy. So the answer is yes. You can have twins, you can have triplets, you can have quadruplets. If a fertility specialist rightly and correctly uses Clomid to help you to achieve pregnancy, we can use Clomid in combination with IUI. When we are using Clomid in combination with IUI, what are we going to do? We are going to make sure you have a regular cycle. Then we give you Clomid so that once you ovulate, we'll tell your partner to make love to you, or we go for our IUI. So Clomid is not your everyday drug you will abuse. The more you abuse Clomid, the more you're predisposing yourself to developing cancer. The more you are actually desensitizing your reproductive system. So the more you're taking Clomid as an abuse drug, the more you are not going to be able to become pregnant. So for any Clomid you're taking that your provider didn't give you, you are actually losing your ability to become pregnant naturally, because you are not supposed to be taking it under your own control. You should be supervised. So very, very important. I know so many of you have been experimenting with Clomid. I know you've tried it by yourself. It's even possible that you tried it and you succeeded in having more than one baby. Let me tell you the truth. Some women are not structured to have more than one baby. So when you go out there to take Clomid and you succeeded in having triplets, you can lose one baby, you can lose two, or sometimes you lose three. I actually had a client in Korea a few years ago. Kenneth can bear me witness. She used Clomid by herself. She succeeded in conceiving 3 babies, triplets. Unfortunately, she lost the babies. This one died, the other one followed, and unfortunately, a lady that was anticipating triplets had no baby. So it's not every woman that can have multiple pregnancy. It's not every woman that will use Clomid. Clomid is only given if you have a need for it. So be careful. Next time you go out there and you begin to have conversation with your friends and they begin to promise you heaven on earth based on whatever you can get from Clomid, take a moment, sit back, go to a fertility specialist. The Clomid I can give you can only be on merit. If you have a need for Clomid, I will give you Clomid. There are some women that don't even need Clomid, because if you have primary ovarian insufficiency, that means you went above and beyond to go into menopause. So women that will go into menopause before 40 are called premature menopause or primary ovarian failure. So if you don't have X, then why are we giving you Clomid? You're not going to get any help. So please be careful. Don't be in a hurry, especially in November. Remember, November is a Thanksgiving month. The same Clomid you might be planning to take by yourself, if you go to a fertility specialist can still use that Clomid to get you pregnant, including succeeding in helping you to have twins, triplets, and quadruplets. But don't take Clomid by yourself. You begin to create problems for yourself by the time you take Clomid without monitoring. Some women can also hyper-stimulate their ovaries, and they will have what we call ovarian hyper-stimulation syndrome. That can be deadly. It means your ovaries will grow so big and they can cause a lot of problems. Sometimes the ovaries will even burst. You don't want to put yourself in danger. You do not want to cause problem trying to become a mother. You want to be a mother in good health so that when you eventually have your baby, you'll be in good health. So please, and please, stop abusing Clomid. Clomid can help you to become pregnant, and Clomid can harm you, including predisposing you to developing cancer. Let me give you a typical example. In your family, your daddy died of cancer. Your mom had breast cancer. You have multiple sexual partner. You've been using Postinol. You are now using Clomid. You don't exercise. You are overweight. You are eating all the food in the world. Guess what you've done? You have maxed all the risk factors that can help you to develop cancer early. And unfortunately, if you're a woman that doesn't go for her well woman check, by the time we discover that you have breast cancer, it's already late. So I want you to be in good health so that when your baby comes, you'll be in a better position to enjoy the dividends of your baby. Now the clinic is open and I'm ready to take care of your questions. So please, in the next 15 minutes, you will have an opportunity to get feedbacks based on Clomid, based on fertility, based on pregnancy and the possibility of leading to cancer. So the clinic is open. I'm going to quickly start taking care of your questions. So please feel free to ask your questions in real time. Okay? My colleague, Dr. Ndiche, is also in attendance, so she will help me to attend to a couple of questions if I'm not able to see your question. But please go ahead now and start asking your questions. If you know anybody that will benefit from this particular topic, after this event, share this video with them. If today is the first day of coming to my clinic, thank you so much. I appreciate you. Thank you for finding time to share your 30 minutes with me. But please make sure you subscribe. We come live every Tuesday and every Saturday. So Tuesday is 7 p.m. Eastern Time, US. Then Saturdays is 12 p.m., 6 p.m. Nigerian time. 30 minutes that can change your family, change your happiness, change the joy you have in your family. So let's go. Hello, doc. Is Clomid prescribed for males too? Yes. Clomid can also be used in treating some infertility issues in males. So yes, Clomid can be prescribed for men, depending on the type of infertility they have. Do you know why? Remember the story I told you about the HPO, hypothalamic, pituitary, ovarian axis. So everything about the hormones in your body are produced in a special place in the brain. So in males, if they have hormonal problems, which you can use Clomid to cut off the balance in estrogen. So the key word is estrogen. Some males can have more estrogen in their body. And if you're a man and you have more estrogen in your body, one of the presentation is what we call gynecomastia. So you begin to develop breast. So if your partner, before you married your partner, right, you used to have six-pack, used to be very athletic, then suddenly your partner begins to develop breast as a male, and he's not exercising, and he's not sleeping properly, and he's eating all the food in the world, and he's drinking, he's smoking. Guess what? That gynecomastia might be a presentation of hormone imbalance. Now, in that particular man, we can prescribe Clomid to counter the effect of the estrogenic effect that is leading to that. So if your partner has male boobs and you guys don't have a baby, and you have been praying, you have been practicing, you have been doing the right things, but you don't have a baby, see a fertility specialist on time. So very beautiful question from Ebenezer. Okay, thank you, doc. Does taking Clomid cause a woman to put on excess weight? No direct relationship between Clomid and weight gain. Now, let me tell you the truth. Most people pretend about their body weight. Your body weight cannot just be what you want based on wishful thinking. Some women might be predisposed to gaining body weight. There are some women that might have hormonal problems, autoimmune problems, so no matter what they do, they keep retaining water. But if you're taking Clomid and you're doing the right things, there is no association between your Clomid and gaining your body weight. What will lead to gain in your body weight is lack of activity and eating the wrong things. If you can increase your activity level and you eat the right things, then your body weight will be good. Now remember, your body weight can either help you to become pregnant or make you not to become pregnant. If your BMI, body mass index, is above 30 and you want to have a baby, as a woman, you are not helping yourself. So higher BMI will lead to delay in your ability to become pregnant. Now, in the same vein, if you are underweight, if your BMI is below 18, you are also going to have problems with ovulation. Matter of fact, when you compare a woman with higher BMI and a woman with lower BMI, a woman with lower BMI will have more difficulty in becoming pregnant because when you don't have at all, you're not even going to release your egg. But some women, ironically, who have a higher BMI can even become pregnant and have twins. So the key word is to be in the middle, 18.5 to 25.5. If your BMI begins to head towards 30, please do something about it. Okay? All right. Are there any alternatives to Clomid? Yes, there are so many fertility drugs out there. So many. Some of them are taken orally. Clomid, the good thing about Clomid is the fact that it's an oral drug, But there are so many injectables, there are so many IV drugs, there are so many alternatives. There are people that might not tolerate Clomid properly, and we can give them alternative drugs. But it's not something you go and take by yourself. So there are so many alternatives out there. What you need to do when your doctor prescribes Clomid for you, some women don't even tolerate Clomid. It can upset their body, it can mess their cycle, it can cause a lot of problems in them. That's your individual factor. So if you're giving any drug and you begin to notice side effects or adverse effects, call your doctor. Don't stop by yourself. Call your doctor. Sometimes we reduce the dose or we increase the dose or we change the drugs entirely. So some women might have a need for other fertility drugs that might not be Clomid. An example is Femera. Okay? All right, let's continue, guys. Can a woman in her reproductive age, say 35, take Clomid? Any woman at any time in her reproductive phase might be a candidate for Clomid. But the only person that will confirm your adequacy, the only person that will confirm your need of Clomid is who? A fertility specialist. If you are naturally ovulating, you're releasing your eggs, and you're taking Clomid, you are punishing your body. If you have gone into menopause, if you have had what we call hypothalamic failure, so if the brain centers are not working properly and you're popping yourself with Clomid, there is no hormone to block. So the only person that has a need to confirm your need for Clomid is who? A fertility specialist. Now, if you're below 35, you actually have a better natural advantage of becoming a mother. Why? Because below 35, you still have a lot of eggs, and some of those eggs are of good quality. But above 35, you have fewer eggs, and you have fewer quality eggs. So this is the reason why we call women above 35 advanced in maternal age. It doesn't mean you can't become pregnant. You can become pregnant, but you have fewer quality eggs to contend with. So women above 35 should involve themselves in more PPP compared to women below 35. Why? Assuming God gave you 400 eggs. Now you're in your 35. For that 400, you only have 40 remaining. What are you going to do if you only have 40 remaining? You're going to contend more to use the 40, knowing fully well that every year you're going to lose 12. So if every woman out there is ovulating, her period is okay, in 2021, you've actually lost 11 eggs and you can't get them back. So once you use your eggs, you can't get them back. Compared to men, men produce their sperm every 3 months. So a man can produce millions of sperm anytime. But once you've used your eggs, you can't get them back. And once you release your egg, like for the month of November, you only have one strike to become pregnant for the month of November. This is the reason why we encourage you for regular lovemaking, because if you miss your chance in November, the next chance you have is in December. Knowing fully well that on the 31st of December, we have a crossover clinic. All our members are going to become pregnant. So you don't have time to waste. Very, very important. Okay, let's continue, guys. Okay, does the response to Clomid vary? Correct. People can respond to Clomid differently. Even twin sisters, one can respond favorably. The other one will have a lot of side effects or adverse effects. So how you respond to Clomid, it's constitutional. It's dependent on your own body mechanism. So some women can take it and have twins, and some women can take it and we are going to send them to the emergency room. So it depends on what your body is currently under. Okay, so there are so many factors that will play a role in how your body handles medication. Okay, let's continue, guys. How can a woman in her reproductive age know if she can be able to carry multiple pregnancies? Couple of criteria. Now, let me give you one criteria. If you have a natural tendency to have multiple pregnancies, that means you have a maternal predisposition of having twins. So your mother is a twin, your auntie is a twin, or you have twins in your family, then you can become a twin by default. Now, some women might not have adequate womb, adequate cervix to carry twins. So you might have what we call cervical incompetence, or you might have womb deformities, or you might have some medical conditions that will not warrant you to carry your baby up to 37 weeks. So how do you know? You go for your well woman check. When you go for your well woman check, we're going to check your fertility index. So we're going to run all the fertility tests. We're going to run it for you. We're going to run it for your partner. If we find anything that might indicate that carrying multiple pregnancy will put your life in danger, we will advise you against multiple pregnancy. So there are some women that might have cervical incompetence and they don't have a fertility specialist, but they are taking Clomid by themselves and they succeed in having multiple pregnancy. When you have cervical incompetence and you're taking drugs that will lead to multiple pregnancy, the possibility you're going to have preterm birth is very high, because once your cervix is not strong, those babies are going to open your cervix and your babies will come out before 37 weeks. Okay, so the best bet is to see a fertility specialist. Can a woman demand to take Clomid because she wants multiple pregnancy? So what you need to do, you actually have a role to play in your family. So if you're desiring to have multiple pregnancy, you can have that conversation with your fertility specialist. Like our fertility specialist in Lagos, in Abuja, in Port Harcourt, in Oka, you can book an appointment. We can check your profile. We can check the profile of your partner. We can check your gynecological indices. We can check your partner's level. We can check your egg. We can check your sperm. Then we can advise you. So yes, you can demand to have twins. Now, it's left for the fertility specialist to know the best way to help you in having twins. Like, assuming you want to have twins, right? And you meet a fertility specialist, and your eggs are okay, your womb is okay, your tube is okay. What are we going to tell you? We are going to encourage you to go for natural ability of having twins if you have the familiar history. But if you don't, we are going to offer you IVF. The only reliable way of having multiple pregnancy with good outcome is IVF. Now, in course of IVF, the outcome of your IVF is dependent on your eggs and the sperm. So if you have good eggs and good sperm, then you're going to have good embryo, which will lead to more than one baby. So your provider can give you advice based on your own situation if you want to have twins. Now, for women above 35, they have an advantage because when you are older, for some reason, the eggs that God gave you can easily multiply. So women that have had long-term infertility can suddenly have twins, can suddenly have triplets, can suddenly have quadruplets. But you can't have this if you don't seek help. So the common denominator of this clinic is the ability to connect with a fertility specialist. Very, very important. How long does Clomid last in the body? Ebenezer is going through academics. So this is what happens. Remember, I told you start taking your Clomid either from day 3, day 4, or day 5. You are supposed to take it for 5 days. Now, because it's orally ingested drugs, any drug you take into your body, depending on the mechanism of action, it will just be within 4 days or thereabout, and it will leave your body. So that 5 days you are taking Clomid, it's expected it will challenge your body. Once it plays this role, it's going to be removed from your body as a waste product. So anytime you are taking any drug orally, the transit time, the time it will be in your body will be shorter compared to using IV drugs. So if I'm giving you a drug in your vein, it's going to get to your system faster than a drug that will go into your mouth. Because if you take a drug from your mouth, it's going to go through your mouth, it's going to go through the esophagus, go to the stomach, go to the intestine. But if we inject the drugs directly into your veins, it's going to have active action. So when you compare the drugs we give women that are going for IVF and Clomid, Clomid will work less effectively compared to IV drugs. Okay? Very important question Ebenezer asked. Does Clomid take repeat cycles? So a good provider can try you on Clomid for up to 5 cycles. Now, once you get to the 5th cycle and you are not able to become pregnant, then we stop. Because the more you try giving Clomid in subsequent cycles, the more the failure rate will increase. So most good IVF providers or fertility providers will not exceed 5 cycles. So what do I mean by 5 cycles? Remember that you're supposed to take Clomid for 5 days. So if we give you Clomid for the first 5 days and your body didn't respond properly, we'll give you a little gap, then we'll try again for another cycle. So if we've tried for 1, 2, 3, 4, 5 cycles, we stop there and we look for alternatives. Is there any duration for women to be placed on Clomid? Normally it's 5 days, but your doctor can decide to, give you more. Normally Clomid comes in 50 milligrams for 5 days. That's the standard. But your own doctor, depending on your own body, depending on your own situation, can give you more. Okay? What other options are available for Clomid if not providing the desired result? This is a question your fertility specialist will ask. So remember, when you are having fertility problem, what's the first thing we do? We ask a lot of questions. We ask you questions. We ask your partner. We send you to the lab. We come back. We begin to see if we can find where the problem is coming from. So some women might not even have a need for Clomid. So you might discover that your ovaries and your ovulation and your hormones are okay, but the problem is coming from your partner. Or maybe you have blocked tubes. So if you didn't respond properly to Clomid, we can change to an injectable form of fertility drugs. We can give you Femara. We can give you letrozole. So depending on how you respond, and the only person that can assume, the only person that can decide is your fertility specialist. So it's not a trial and error thing. It's something we follow due process to tailor your need. So every woman's fertility problems is tailored. What will work for you can only work for you. What will work for you will not work for your twin sister. So very careful. This is why you cannot take the advice of your friend that told you, oh, I took Clomid and I have triplets. You can take that same Clomid, your friend too can have triplets, and you can die. Okay, very, very important. Okay, so for how many months can one take Clomid? Like I said, you're asking the wrong doctor. I can't tell you how many, how long, or when, or not when. Your fertility specialist is going to be the person to tell you what to do. But generically, once you have done 5 cycles of Clomid, that's the cap. You don't go beyond 5 cycles. So 5 cycles means if you see a fertility specialist and he gives you Clomid for 5 days. Let's assume you started taking it in August. He gave you Clomid in August. You ran it for that 5 days in August. You didn't have desired result. You came into September. He tried September, no desired result. He can go for October. Then when he comes to November and December, we begin to look differently. So we don't want to continue to challenge your body with things that are not working. Remember that anytime you take any drug in your body, you're paying for it. So we don't want to be pumping your body with artificial hormones that can predispose you to dangers in the future. Okay? All right. Okay, guys. My time is up. Thank you for coming. The next clinic is going to be on Tuesday. So keep a day with me on Tuesday. I think on Tuesday, we're going to look at the first period of your daughters. It's called menarche. It's a very important milestone in the life of a woman, in the life of a girl, her first period. So on Tuesday, we're going to talk about menarche, the very first period your daughter will have. We're going to talk about how you can help them to transition. And with the world we are living in now, your girl as early as 9 years can start having her bleeding. And once a lady is bleeding, she can become pregnant. So your 9-year-old daughter can become pregnant. So we need to protect them. So that's going to be my topic on Tuesday. And thank you for coming. I love you guys. Make sure you practice. If you are currently abusing Clomid, stop. It's not going to yield any results. See a fertility specialist. If you haven't registered for our retreat, we have couples retreat on the 28th. SGHS Believing for Baby Couple Retreat. Tell your partner you need to attend. The aim of this retreat is to graduate you from Believing for Baby to A and C. So admin is going to provide you with the details. Make sure you attend. If you need to consult with me, make sure you go to our group, go to our website. Admin, if you can post our website, click on the website, decide on the package you want, then I'll meet you halfway. Until I see you guys on Tuesday, I love you. Remember to tune in tomorrow to my clinic tomorrow. I think tomorrow I'm going to talk about alcohol, the effect of alcohol in female and males, okay? God bless you. Enjoy your weekend, and bye-bye for now.